Hello, this is Dr. Reilly. Today we're going to be talking about PCOS. This is the second video in our series. Today we're going to be talking about the medical nutrition therapy that apparently is very good for the PCOS. And if you remember, the PCOS has a lot of different symptoms that we're looking to see if we can kind of get rid of. And these are very troublesome to girls. But one of the problems that I see is that a lot of the kids don't even have any symptoms. They only have blood symptoms, as we talked about in the first video. And part of the reason why we want to get rid of all these kinds of things is for this, like we show on this slide, where, yeah, if you start out having hormone kind of problems, then it can dog your steps for the rest of your life. So, like a lot of things in life, if we can just see if we can kind of nip it in the bud now, this will actually be very good for us. So, this is the second stage in how you take care of somebody with PCOS. So the first thing you try to do is go after their lifestyle, right? So we talked about that in the first video. And the second thing that we can do are certain natural kind of interventions that, although you may not want to be able to do it, you may not want to do it the rest of your life, when you're actually having symptoms or lab abnormalities, this would be a good time to intervene with these kinds of things. And first on our list is the omega-3 fatty acids, which seem like they're good for everything. And one of the things that they're very good for is inflammation. And you're going to notice a theme as we go through all these slides, that everything that we're going to talk about is good for inflammation, because remember that PCOS is an inflammatory kind of disease. So everything that we seem to study that's good for inflammation seems like it's good for actually PCOS. So omega-3 fatty acids, for those of you who don't know, there are essential fatty acids, and there are two classes that are super important for our bodies, the omega-3 and omega-6. And unfortunately, the food nowadays seems to have a lot of the omega-6 fatty acids, and the omega-6 seem to be what we call pro-inflammatory. That's right. So unfortunately, the most common fatty acids that we see in our diet nowadays cause inflammation, which is probably part of the reason why we see 1 out of every 10 ladies suffers from PCOS. But we can restore the balance by actually eating more omega-3 fatty acids. And the best source of omega-3 fatty acids is wild-caught fish. Now, if you're like a lot of my kids, when I mention this and they make the crinky face, then we can always get it as a supplement, right? Now, one of the problems with supplements in the United States is that they're not regulated. So it's the kind of thing, some of them are not very good for us. So one of the things that you're going to have to do is you're probably going to have to search out a supplement if you choose to do that, and make sure that it's third party tested. So that way you're not depending on the goodwill of the company to be making a quality brand. Now, omega-3s are available as prescription because, like I said, they are seemingly good for everything, but they also tend to be fairly expensive to get it that way. And probably the most cost efficient way is to eat fish. Now, berberine, probably most of you haven't actually heard of berberine, but this actually is like something real, and it's been studied for a long time, and mostly it's been studied for sugar metabolism because it has an effect on AMP kinase. But it seems like this effect on sugar metabolism also has a good effect in PCOS, as you may glean by looking at the title of this article, that it definitely seems to have a very salutary effect on women's hormones. So berberine is something that you can get almost everywhere, but again, it's a supplement. And like all the supplements that we're going to talk about today, you have to make sure that who you're getting it from is actually a reputable company. And ideally, they should be third-party tested. That means tested by someone else to make sure they're actually having what's in it, what they advertise that's in it. The normal dose is about 500 milligrams 2 or 3 times a day, and the side effects are fairly negligible. Inositol. So if you saw our video about anxiety, you see inositol is actually very good for anxiety, but part of the reason why it's good for anxiety is also why it's good for PCOS. It is anti-inflammatory and it is natural, meaning that you usually get inositol when you're eating fruits and vegetables, but you can get mega doses of the inositol through getting it as a supplement, and it usually comes as a powder. And usually what we give for girls when they have PCOS is 2 milligrams twice a day. And this is usually something that actually works very nicely. Usually it has to be dissolved in water or something else that you're drinking. The inositol, nobody really knows exactly how it works through, and it's an antioxidant fashion, but or a function, but it is definitely something that works very well. Now, another famous kind of antioxidant that actually seems to have good effects in PCOS is coenzyme Q10. Now, coenzyme Q10 is normally taken by people who, when they're taking statins, but it is actually a very strong antioxidant, and it's fat soluble, meaning that it's absorbed fairly well, and it does seem like it has a very good effect in PCOS by itself. But when you pair it with vitamin E, it is one of the very few things that can raise the sex hormone binding globulin, which when I see patients, a lot of times the first thing that I see is the decrease in the sex hormone binding globulin. Now, the sex hormone binding globulin, exactly how it's made is too much to put in this video, but it is one of these very key kind of things. So anything that we can do that raises it is actually going to be good for us. And it seems like this combo works in the liver by increasing our ability to produce sex hormone binding globulin. So it actually has a very salutary effect for ladies with the PCOS, especially if they're one of the ladies who has seemingly a lot of symptoms, and the only thing that we see is that they have low the sex hormone binding globulin. N-acetylcysteine is another famous antioxidant. It became extra famous during COVID-19 because it seemed like there were a lot of studies that said that if you took N-acetylcysteine, that it seemed to help you with the cytotoxic storm that seems to happen as part of COVID-19. But it's also very good for PCOS too. And it seems to work by replenishing glutathione. Glutathione is your body's main antioxidant. So anything that seems like it does a good job for glutathione is actually going to be good. So the dose for this is going to be 600 milligrams twice a day. And again, it's available over the counter, although it is in a little bit of a short supply because a lot of people have been snapping it up to help them with the COVID-19. But it is something that should have virtually zero side effects, and it seems to work very nicely for people with PCOS. It seems to decrease the testosterone a significant bit. Now, I put the polyphenols in this section, even though they're really found in food. But it is something that you can get polyphenols, not just by eating all these colorful foods like you see in this picture above me, but you can get polyphenols by eating more spices. So if you're adding more spices to your food, you're adding polyphenols, and it seems like polyphenols are also very salutary for PCOS. So as we've been starting to eat more bland kind of foods, eating more processed kind of foods, one of the things that's decreased is the spices. So if you want to get better with your PCOS, then you should just spice it up. And I think probably it's fairly common knowledge that turmeric is one of these spices that has a very high polyphenol content, is very good antioxidant. But as you look at the chart, you'll see a lot of the other spices are very good too. And they're not very expensive to add a little bit of oregano to the things that you're eating, and you'll enjoy it more. So I would say, look at your foods and spice it up. The last thing that I want to talk about is heat therapy. So here I put this study that was recently done where they actually told ladies to take hot baths, and who knew? That actually seems like it's good for PCOS. But it is very congruous with a lot of the other things that we've seen. In some of the other videos, we talk about how heat therapy, using saunas and hot yoga and all that kind of things, seem like they help with inflammation. So it makes sense that even doing something like taking a hot bath, raising your body's temperature, probably in the same way that exercise helps with PCOS, has a salutary effect in your hormones and could be a very low risk way of controlling your hormones. So I hope you got something out of this short talk. Again, if you like these videos, please do not forget to like and subscribe. This tells Google for other people when they're searching about natural things to do with PCOS, it'll actually let them know that this is actually something that's good for them. I've been Dr. Reilly, and if you're interested in hearing about some of the medicines that we use, then stay tuned for PCOS Part 3, because then we're going to be talking about some of the medicines that we use to take care of the PCOS. Thank you.